Welcome to this week's episode of Talk of the Town. My name's Philip Sweisgood, and I am back with my good friend and co host, Dr. Kenneth Harper from Vein Specialist of the South. Now, if you have questions about your veins, give my friends at Vein Specialist of the South a call and get the answers that you deserve. We also want to thank this week's presenting sponsor, which is Piedmont Healthcare. Piedmont provides comprehensive, quality healthcare for all of your medical needs. Thanks so much to Piedmont Macon for making a show like this possible and for investing in Central Georgia. Now, if you're just waking up on Saturday morning and you're wondering what in the world is Talk of the Town and who are these people on my television, here's what you can expect from me and Dr. Harper week in and week out. A conversation between us and someone in the community who has a story that you need to know about and that we want to share with you. This week is no exception because we are here with Cass Hatcher, who is the CEO of River Edge Behavioral Health, and we have a fantastic conversation ahead of us about tiny homes here in Central Georgia. Cass, thanks so much for joining us.
Well, thank you for having me.
Cass, we're here to talk about tiny homes, but first, tell us what you guys do here at River Edge.
Well, River Edge is a state-funded agency that provides mental health services, substance abuse disorder services, and serves for people with intellectual development disability. We serve both the insured and uninsured, and basically we're here to serve Middle Georgia who have any behavioral health needs. We're here to provide that service.
In the lead, we talked about tiny homes
Yes.
and River Edge impetus or motivation in creating tiny homes in Macon. What is a tiny home and what do you have to be to qualify as a tiny home?
So a tiny home, it depends on who you talk to. So a tiny home can range from 400 square feet to 600 square feet. We stay in that range in terms of our tiny homes. Nothing exceeds 1,000 square feet. And so it has to be basically single family. Basically, we like house to be visitable in terms of universal design, no step entrance, allow people to basically live and age in their home. And so we designed it to that specification.
Kat, you've been instrumental in really the revitalization of Macon, and you've been here a good while.
Yes, I came here in 2002, came to River Edge in 2010, and my whole goal was to help to change the face of affordable housing here in Macon. I think I've done a pretty
And
decent
we're
job.
making good progress, right?
We'll make it, but it's a lot to be done. And
Right.
so I served a little bit as the blight czar under Mayor Ricker's administration. So I know where all the skeletons are and all the neighborhoods that need to be revitalized. So and that's one of the things that we target when we're looking to do any type of development for River Edge. We go to those blighted neighborhoods and revitalize them and put houses there.
So what was the first tiny home area y'all created?
The first tiny home we did was on Maynard Street. It's called Maynard Village. It was 5 tiny houses. So Mayor Rickard at the time convened all the agencies who dealt with the homeless into his conference room
Right.
and said, I want to build some tiny houses. And so we basically volunteered River Edge to say, let us look and see what's out there in terms of tiny houses. There are small tiny houses that are 8 by 10. There are some that are really grand in terms of their size. We need to be somewhere in the middle. So we built our first 5, and we wanted to see 2 things. Number one, would someone who was homeless want to live in a tiny home? Then secondly, what would the neighbors think about you building tiny homes in their neighborhood?
Right.
And so basically we checked those 2 boxes. And so once we built those 5, everybody wanted to do tiny homes. And so we started saying, okay, well, let's look at our demographics in terms of who we're serving, with tiny home fit. And so working with my housing director, we said, yeah, we need more tiny homes than that. So that's what we
Okay.
landed.
So tell us about Serenity Courtyard, which is one of the newer
Because
developments.
Serena Courtyard is basically coming out of the pandemic. And so we decided that we need to basically build something that was to allow people to social distance and not to build a multifamily high rise and for seniors. So Serenity Courtyard is for seniors 52 and older. And so we wanted them to be able to have some activities. So we built this huge courtyard on 9 acres, 26 units for housing. The units back doors face to the to the courtyard, and they'll be able to walk and enjoy the outdoor space and also interact with their neighbors in that community.
So it's kind of the best of both worlds. They have the communal aspect of living, and they obviously have their own place still.
Yeah, have their own places. And that's what we want to do. We want to give them the dignity. As you age, some of them who are homeless, maybe, lost a spouse, maybe came up with some substance abuse. They had the dignity of living in their own home. Now they're homeless. They have a disability. We wanted to give that dignity back to our seniors. And so that's one of the reasons why we did Surrender Courtyard as well.
So, Cass, I imagine most people have probably never been inside of a tiny home, have probably never seen what a home that's 500 or 600 square feet would actually look like on the inside. To most of us, it sounds really, really, really tiny. But as I understand, I was doing some reading today. Whenever you actually go into these homes, they're actually much bigger and they're much more thought out than probably most people would actually imagine. Talk to us about what it's like to walk into a tiny home for the first time.
So we do a little trick. And so when we did our first tiny homes, I put in what they call a dormer. And so basically you open up the ceiling and bring in some natural light. And so I can remember the contractor, Stafford Builders, who built the first ones for us, said, I can save you some money, Cass, if I get rid of this dormer. I said, no, because I don't want people to feel like they walk into a shoebox. So when you walk into the space, you walk into a natural lighted area, high ceiling, and so you don't feel like you're so small. As we start to build two additional developments, we raised the ceilings up to 10 feet. And the ones on surrounding the courtyard, it is an A-frame. And so when you walk in, you basically walk into an A-frame building and the ceiling is about 12 feet high.
Right.
And so it gives you that illusion that you're in a bigger space, but you're actually in 600 square feet.
I'm assuming these are really very energy efficient homes.
Yeah.
What is it average? I know what my home costs. It's a 1937 house, and I know what it costs me every month for my utilities. What is an average tiny home utility?
It probably ranges right now between, if you're looking at all utility costs, probably between $180. One thing that we do is basically insulation. We make sure that they are basically rated with the Energy Star. And so we use the R value of insulation has to be high. We used to, and it got too expensive, we used to foam all our houses.
Yeah.
And so we basically said, the price is getting too high, so we just started using just good quality insulation inside the buildings.
So if people are at home watching and they're saying, what do people have to, what qualifications do you have to have
So-
to maybe be considered for the program?
So River Edge is probably one of the largest permanent supportive housing agencies here in Central Georgia. We do what we call the balance of the state. The state receives money from HUD to provide rental assistance for people who has a disability and are homeless. And so we've received, River Edge, luckily, knock on wood, receive a bulk of that money. So to qualify, two things. You have to be homeless. Have to be living under a bridge, coming out of a shelter, living in a place that's uninhabitable. And so that's the homeless definition. And then you have to have a verifiable disability. You have to have from a doctor say that you have either substance abuse disorder, you have mental health, you have a physical health, IDD. Once you have those two verifications, you qualify for permanent supportive housing. So you say, I'm homeless, I'm living in a shelter, I want housing. Then you have to go to Economic Opportunity Council because they do an assessment. There's other housing options available to people. There's public housing, there's rapid rehousing, and then there's permanent supportive housing. That assessment determines what is the best housing option for you and your family. So once the assessment is complete and determine that permanent housing is the best choice, then they will refer you to us at River Edge, and then we will interview you and move you to a home.
Cass, talk to me about some of the services that are available inside these homes. Like, is this something to where is there a standard, stove, microwave? Like, are you able to get Netflix in here? Like, is
All of the above.
all the above?
So
it's like a
we-
normal home.
So we treat our individuals in our program just like I would treat any tenant who will coming in to buy a market rate apartment complex. Granite countertops, basically LED lighting, microwave, full-size refrigerator, and internet services as well. So we don't treat anyone any differently just because they have a disability, they're homeless, because we want to give them that dignity and allow them in their recovery. It's hard for anybody to recover from substance abuse or mental health service if they don't have a roof over their head.
Mm.
And we provide that roof over their head to make them and to aid them in their recovery throughout their lives.
Right. So do you have any stories you'd like to tell about some of the people who've
Well, the young lady we just moved into our newest tiny house, which is on Norris Street, it's called Tiny Cottages of Macon. She came into the house and started crying. I got a mansion, 600 square feet, and I got countertop, and I got wood floors, and I got this, and she just bought, it just kind of, gets you, Yeah, so somebody coming off the street to be able to live into something like that is different.
Cass, I want to ask you a question about homelessness, but first we have to take a quick break to hear a word from our sponsor.
I'm a mom, military wife, and enjoy roasting coffee as my hobby. Early in my second pregnancy, I worked in nursing and on my feet all day. I developed large varicose veins in both legs with constant pain. Even at my young age, my legs looked awful and I was embarrassed to wear shorts. Everyone recommended Vein Specialists of the South, but my husband was transferred to Tennessee. Wanting the best, I decided to make the trips back to Georgia, and it was worth every mile. They found I had vein disease and blood clots. and recommended a comprehensive treatment plan just for me. Being emotional, the entire staff truly cared and comforted me just like family. After my procedure, my legs look and feel great. I'm able to stand for long periods with my hobby, roasting coffee. I encourage you to call Vein Specialists of the South today. Take it from me, it's worth the drive.
Piedmont Macon is proud to be your partner in healthcare, in business and in the community. From our 2 convenient hospitals and ERs, our cardiac program, women's services, and urgent care centers, we provide Middle Georgians with comprehensive care close to home. Our goal is to empower you through great care that's simplified, unified, and easier than ever to access. Our mission is to make a positive difference in every life we touch. We want to be part of your family and your life and to make our community a better place to live.
At Rathville Tire Master, we've been your auto care and tire headquarters since 1963.
If your check engine light comes on, you're in need of any scheduled maintenance, in need of any brake work or an alignment, visit one of our 6 Rathville Tire locations in Macon and Warner Robins.
And log on to rathvilletire.com for additional savings, rebates, and information.
Whatever your needs are, we're here to help.
At Rathville Tire, auto care and customer care are our business.
We're back with another Medical Minute where we ask Dr. Harper your vein-related questions. Dr. Harper, the question this week is, how can someone improve the circulation in their legs?
I thought you were going to ask me how you could improve the circulation in your leg, but I'll answer both questions, okay? First, you want to be about wellness, and that involves your diet, your exercise. If you have some swelling or other issues in your legs, you should see someone to be evaluated. We recommend compression socks to help with swelling or discomfort in the legs, and elevating your legs when you're at home reading in the evening or watching TV. There are a lot of great things you can do to improve your health. And so exercise, elevation, compression, healthy weight management, all big parts of that. We even have supplements that you can take that can support your venous leg health.
So if you have questions about your veins, give my friends at Vein Specialist of the South a call today. Welcome back to Talk of the Town, where we are here with Cass Hatcher having an incredible conversation about tiny homes. Cass, I want to talk to you about the demand for tiny homes since the pandemic. Of all places, the Wall Street Journal has had several pieces over the past year or two chronicling the rise in homelessness across the United States. I believe 2 years ago, the actual homeless rate rose by about 12%. Last year, it rose 10%. And so theoretically, there are more homeless people now than ever before who are in need of your services. Is that kind of what you guys have experienced?
That's what we experienced, number one. And number two is that basically they're aging. And so that's the need for Serenity, 55 and older. And so we decided that we will go ahead and focus on that demographics. And even the individuals that we serve in just in our regular programs, the numbers between 44 and 62, they're our highest demographics for us. And so basically we are focusing on that. We look at data and see exactly where the data takes us. And so with the rise of homeless for the seniors, that's why we focused on Serenity Courtyard. Now, here's the problem: finding the resources to do it. Everything that we build is grant funded. So we basically hustle, bustle, we look for pennies under the seat cushions to make sure we find the money to build this. And so we've been lucky in the past to write grants. The grant for Serenity Courtyard, for example, came from the governor. He had a housing program. We applied statewide. We caught the bus. And not only that, then we asked for support from the county. They provided money. We have a foundation, our River Edge Foundation provided money, and the Community Foundation. So put all this money together to basically to make the deal work and to be able to deliver homes for the homeless.
So how much does it cost to build your last ones that you've been building? What are you seeing you're spending?
Right now, we're probably, when I first built the first ones, our first 5, it was about $55K a unit. And they were like 394 square feet. These are costing between 120 and 130K. In terms of building the building itself. The challenge is always the site work. Right. We find if you go to a blighted community, you're not going to find some of the best sites that you're going to work with. Right. And so we spend a lot of money prepping the site to make it ready for the homes.
But for perspective, the median home price now is over $480,000 in the United States. So as the affordability crisis has escalated on the home front, this is an incredible option for some people.
Incredible option.
So one of the things that our mayor has been and government officials really been working on blight. Tell us how y'all help with that and what your interaction is with that project.
So before in another life under Mayor Rickett, I was the blight czar for the county. And so basically I went around for the 4 years, identified blight and worked with the commissioners, and we identified blight and built some buildings. And so the Mayor Miller has taken it to another step and used code enforcement, which I think is the right move. And so when we're looking at development, we go into blighted neighborhoods. Everything that we built on the River Edge has been once a blighted neighborhood. For example, our development on Emory Highway, our first, second, and third neighborhood, it's basically a whole block that we took that was blighted and built new houses on. The houses that the first group of tiny houses on Maynard Street, we received funding property from the Hardeman family. They gave us some blighted property. We tore down the blighted property and built our property. So what we're doing is basically going to those blighted communities where there's been no development in the past 20, 30, or 40 years, and then putting in our affordable housing units.
So your organization is much more than tiny houses.
Oh, yeah.
So we all, we have business downtown. We live on the east side, my wife and I do. And, you see the people at the exits and you see the people downtown. Sometimes you try to reach out and it's as if they don't want to be helped. So how does Macon what ideas you have, you see them in working to make a difference?
Well, we have several teams that we will have at River Edge. One is called the ACT team. And so the ACT team goes out and see those people who are on the street and try to help them. You're right. Some want help, some don't want help. We offer services to them. We work with the county on some encampment areas where we go in and try to talk to them, working with Pastor Jake about trying to get them mental health services. Some individuals don't want the services, but we're here to offer them. Those that we can serve, our policy here, we have no closed doors. All our doors are open. And so we can encourage them, we can plead with them, but they have to make the choice whether they want to come in for services. And if they come in for service, we will speak to them. So anytime we're called about an encampment, anytime we're called about someone happening in crisis, we have the facilities, we have the expertise, we have the staffing here to support that 100%.
Who typically reaches out to River Edge for help or identifying a crisis area?
We have partnered with Daybreak. We partner with the Resource Center. We partner with all the agencies that we deal with. We're part of the Homeless Coalition. And so we all work together so we know exactly, the population out there. Sometimes we work with the same clients at times. We work with EOC. So we're part of a network, the Homeless Coalition, in terms of identifying what is the need out there. And so even talking with them, as I mentioned with Mayor Rickett, that was the Homeless Coalition he put together to say exactly how can I build tiny homes and who would build them. And so then we raised our hand and said we would.
Cass, if someone's watching this and if they say, I know someone who desperately needs this, what's that process like for them to get in touch with you guys? Or who is it that someone should get in touch with if they think a service like this would be appropriate for them?
A couple of things. They can call. We'll have a website, and our website number has all the information in terms of contacts, in terms of where to call. We have an open door policy here in admissions. And so basically, as soon as you come to our front door, go into our admissions area, they will basically have a service coordinator who will work with you, do a kind of a quick assessment, take you to whether it's substance abuse, whether it's mental health, they will be able to serve you as well. If you're in crisis, if someone who is in serious crisis, then go out to our new building out on Fulton Mill Road, which is our recovery center, where we have 24/7, 7 days a week, crisis services, anybody walk-up services, anyone in crisis can go to that building and be seen by a specialist.
Or if someone comes, are they charged or
we serve the insured and the uninsured? So if you
Okay.
have insurance, we can bill your insurance. If you have no insurance, we're not going to turn you away.
Right.
And so we will provide that service. And so we are consider ourselves the safety net for Macon Bibb County.
Right.
Cass, if you guys are impacting 380 people right now, how many of those do you think are children?
Last count was about 160, I think.
Wow.
Yep, about 160. So we have scattered site housing. So here's an interesting story. So the city had built all these houses for homeownership back in 2008, and they couldn't sell them. And people started to vandalize their homes and basically taking the copper wire. So we went to them, River Edge, and said, hey, why don't you just give me these houses? And then we'll go ahead and rehab them, and we'll go ahead and put families in there who are homeless. Because at that time, the demographics were, we had homeless families. So right now, we have some 21 scattered site houses that houses family with children that's scattered out throughout Macon.
Wow.
So,
And because of the work that you guys are doing, there's literally children that have a home now that
exactly. Yeah.
All right, Cass, I'm curious. We've talked a lot about tiny houses. There's some incredible things that you guys are doing here, but what else is going on here at River Edge and what's in the pipeline coming up?
Well, here's what's happening. If you go behind the jail right now, you will see this gorgeous building just coming up out of the back, kind of out of the sky. This is a specialized clinic for people with intellectual developmental disabilities. Not only is it going to provide crisis services in terms of have 16 beds, but it's going to provide a complete diagnostic center associated with that. And guess who's going to operate that for us? Mercer University, Mercer Medical School.
Really?
And so basically they'll have dentistry, physical therapy, occupational therapy, x-rays, mammograms, gastrology, all the services that you and I would go to for a specialist, it will be provided to that population. People will come around from the states who have clients with intellectual development disabilities would come there for that service. And so this is first of the kind in the nation. And so originally they were going to build this down in Brunswick. The Department of Behavioral Health and Developmental Disabilities sent out an RFP. We did not apply because we had so much going on. And so Gateway, who is like a River Edge down in Savannah, won the bid. But the state said, the department decided, hey, we need to move to Central Georgia because of the hurricanes. So Gateway, why don't you partner with River Edge and work with them and build in the middle of Georgia? So we sat at the table for about 2 months. Gateway walked away, and the State Department said, it's yours, Cass, so you guys go ahead and build it here in Macon. So now on March of this year, probably April, we'll be finished construction in March. We have fully operational in April. This will be the first of its kind specialty clinic for people with intellectual development disabilities. And we're excited about that.
I know this is partly an estimate because you don't know the numbers yet, but how many people do you think a service like this is going to impact in Central Georgia?
This will impact probably thousands because this clinic will be open to everybody in the state. State funded, basically is mandated by the state. So they have money appropriated for years. Now we're basically making it a reality here in Macon. So I'm really excited about that. I'm sure the Commissioner of Behavioral Health and Intellectual Development Disabilities, Commissioner Tanner, I'm sure he's happy that we're going to go ahead and finish this building. Right. So that's that building. And now we're building Riverside Drive. We have 2 properties that we identified, we purchased, and we're building a new peer support building. So we provide day services to over 200 people. People who come here for anger management, come here for just different services during the day. We provide meals to them in terms of lunch. And so we do that in this building right here. We're building a separate building just for that service, for behavioral health and people with intellectual development disabilities. So I went to the clients and say, if we build a new day program building, what would you like to see in it? We'd like to see a gymnasium because we want some physical activity. We'd like to see arts and crafts. We want a music room. And so they gave us a laundry list and we're building it. So we're building a 36,000 square foot, we call it Peer Support Integrated Community Center on the back end of Pleasant Hill off of Riverside Drive. So you go down, you're going away from downtown, down Riverside Drive behind the QT. That's going to be our new headquarters and outpatient clinic. And so our outpatient clinic will be designed just like your building is designed. It's going to be a true outpatient clinic. Anybody with a substance abuse disorder basically will be seen there, get medications. We have a pharmacy in-house to see their medications, leave, and then they can go through the end of the day. Just like we go and see a doctor, they'll be able to have that service there on Riverside.
So if you've been driving down Riverside behind the new QT and you see dirt moving around back there and you've been wondering what it's going to be, that's it, right?
Yeah. So the building is still there. So Natalie Liz is still there. We just crushed it up. The pile of dirt you see in the parking lot. And so that's the building that was once there, the post office, and the library that all was there. So we just basically took all the concrete and grounded it up, and we're going to be using that space. And so it's still going to be there, but it just won't be in the same configuration.
Cass, if someone watched this episode and if they were inspired by the number of people that you guys have just impacted in Central Georgia in so many tangible ways, and they want to volunteer or maybe make a physical donation, where would you send them and what would you tell them?
I would send them to our website and to our River Edge Foundation. So we have a huge active foundation that is basically, and right now I have a huge capital campaign going on to help raise money for our new headquarters building. And so we've acquired Scott Siegel, who is basically with Truist Bank, and he is our campaign chair. Mm-hmm. And so we're excited about having Scott on board. But there's a donation button on our website that you can click that button and then donate to River Edge in terms of any contributions. And it doesn't have to be for our capital campaign. We get donations just for the service that we provide for our clients. We have Internally, we have what we call our REACH program, where our staff donate money for services for our individuals that we serve. And so basically, at the end of the day, if we raise, say, $50,000, and then each of the departments decide what services they want to provide to those clients, whether they want to give them a party, whether they want to do coats, whether they want to do toiletries, they put in a request, a proposal, and then we fund it through that REACH campaign. So we internally are supporting our clients, and anybody who wants help on our side, we're more than welcome to have them donate.
So what's the website address?
The red website is river-edge.org. And so you hit that and you just Google River Edge and you'll see everything. Go to our website. We keep it uploaded with all the things that are happening in terms of our facilities, our services, our programs. We just had a program here with our IDD individual. We had AJ the DJ. He came in here and played in this room and they were dancing the jig. So it was a good time to have our own.
In your wildest dream, when you were serving, protecting our freedom in the Air Force, did you imagine you would be here in Macon one day and doing this kind of thing?
Well, let me just, I'm a product of public housing in Birmingham for a smaller time. And as an architect student, I used to say that there's something you can do different with public housing. I used to always say that, and and so kind of funny how God, here's your thoughts,
Yeah.
and leads you and guides you. So I never thought that He would send me to making it work with the housing authority and learn all about HUD and learn all about the regulations and learn how to maneuver through the system. And then so I thought that after I finished the Hope 6 there, hey, I'm happy I did what I wanted to do. Then He led me to River Edge. He said, no, I want you to serve even those who are needed the most.
Right.
And now we're serving people who are basically disabled and are homeless. And so we've probably developed close to over 100 units for housing internally. And that's not including the ones that we're getting ready to do with Serenity Courtyard.
Well, you were prepared for this job from a long time ago,
From a
weren't
long
you?
time ago, yes, sir.
And when you got somebody that's prepared, passionate, a leader, and has what it takes to do it, there's no surprise that you've been successful.
So you got to have a good team.
Right.
And so right now we have a great team at River Edge, in terms from the leadership, our board, who's led by Dr. Kokri, all the way down to the clinician, all the way down to the person who basically is our janitorial service.
Right.
Everybody here has a passion and a drive to serve, to help people who are disabled. And so, and then it's a calling. It's just not just a job, it's a calling if you want to come and do this kind of work.
Well, Cass, your impact on the community is just tangible and makes Central Georgia a better place to live, work, and play. And we're just so grateful for the work that you guys
Well,
do
thank
here.
you. Thank you for this opportunity, and thank you for allowing us to spotlight River Edge. As you said, Doctor, they know River Edge, they know the name, but they really don't know what we do. And we've been a little bit under the radar, and so we're trying to be able to come from under the covers to let people know that we're here to serve.
Great.
And thank you guys for tuning in as well. And stay tuned for where me and Dr. Harper might show up next, because you never know where it might be.